Hello. Hi, everyone. My name is Yehuda Kogan, and I'm the CEO and co-founder of Lean Health. Very excited to be here today with you. And I'm even more excited about our collaboration with the most innovative health system in the world, I would say, Mayo Clinic. We collaborated to help people with chronic pain reclaim their lives from pain. I can tell you that being in pain is something that you don't really want to do. I've been in pain for 8 years, and it really affects your life. So I'm very mission-driven about what we do. And before I tell you about Lean, I want you to hear it from one of our partners. Dr. Adler is a pain physician at Tufts Medicine, and she has embedded Lean into her clinical operations. So she speaks about the value that we create to our patients. First, about how amazed they are that they can actually get treated very quickly. Not very common in the healthcare system in the US, as you probably know. The second thing is that she speaks about how we do that. Her patients feel supported and safe. And then she speaks about the value that we create for them. They experience better quality of life, and some patients, reminding you that these patients have been in pain for years, are achieving 100% recovery. She refers to the fact that our service is covered by insurance and it's low cost, very important from accessibility perspective. And then she speaks about what's in it for her. And that's the key. Lean is an extension to safely address the brain component of chronic pain. Patients have been hearing for years that pain is in their heads. And guess what? This is true. Chronic pain is now considered an underlying disorder driven by the brain. The medical community has known that for years, but now it's official. Our brains can create or amplify the pain sensation. And the safest way to address the brain and to treat the brain is through behavioral approach. And it's not that it's just safe, it's also effective. In the past couple of years, a couple of behavioral techniques has been introduced. One of them you can see here on the screen. It's called pain reprocessing therapy. It has been researched and published on JAMA Psychiatry. And more importantly, it shows better outcomes than treatments as usual. So we have created a program, a digital program, that is comprised of a personalized care plan to empower the patients and deliver them with the tools to themselves. The second piece is that we connect these patients to a care team that is comprised of a pain recovery coach that is trained on our protocol and platform, and is supervised, and everything is supervised by physicians. The thing with chronic pain is that it impacts everyone. Patients are suffering because they are mistreated. If you land with a spine surgery, it might be unsuccessful. Payers are seeing utilization cost goes up because of these patients bombarding their emergency rooms. And then providers and health systems who are in need of getting more patients through their front door are seeing these patients clogging their primary care. So we have created a business around that by bridging the gap, first by creating a consumer-grade, superb patient experience. Our patients are engaging with our program every 2 to 3 days a week. They stay for 6.5 months, and knowing that the research is there, this engagement is driving clinical outcomes. The second piece is that we made our service covered and accessible by partnering with health systems that have 27 million lives. So these people can actually use their insurance to benefit from our program. And the last point is that there's no better way to bring a new modality into the market than by partnering with the best advocates, providers, physicians, who are in need of finding a first-line approach to chronic pain. And today we are announcing our collaboration with Mayo Clinic. And we do that to support their fibromyalgia patients in Minnesota to develop a joint program. And based on the early results that I'm going to show you in a second, we have already expanded to support their primary care patients in Arizona. And here are the results. In 6 months, close to 500 fibromyalgia patients were referred to Lynn. So the volume and the need is definitely there. And what we have seen very quickly is that we can help these people. And you can read this quote. For the first time in those 10 years, I feel like there is a light at the end of the tunnel. And this is a quote from their patients. Last, we're announcing today our latest round of $5.2 million led by this great group of investors, including Mayo Clinic. And before I end, I just want to leave you with that. We're not disrupting healthcare. We are not reinventing healthcare. Our mission is to partner with providers and payers to help people reclaim their lives from pain. Thank you for listening.